the JAMA Network.
Jean Stagg has been in and out of the hospital about 7 times this year.
I was out like one day and I was back in again, and I was out a couple of days, I was back in again.
A lot of patients run into problems after they leave hospital. It can be a very confusing time.
Dr. Irfan Dalla from St. Michael's Hospital in Toronto and co-authors examined whether or not a new model of care known as the virtual ward would help keep patients from being readmitted. This is the virtual ward at Women's College Hospital in Toronto.
So that we know sort of prognosis and what my transition plan will be for.
The team meets daily to discuss patients being discharged and patients who are already back home.
The idea was to produce a sort of customized care plan that would be exactly right for that particular patient.
Nearly 2,000 discharged patients were followed over the course of the 4-year study. Half the patients received care from the virtual ward that included contact by phone.
How have things been going since you've come home from the hospital?
Coordinating care with a patient's primary care doctor, along with clinic and home visits.
Where do you think you'd put your overall health on that scale from 1 to 100 today?
I'd say maybe 75.
We didn't reduce readmissions or deaths after discharge nearly as much as we had hoped.
This study appears in JAMA, Journal of the American Medical Association.
We really didn't see a significant reduction at 30 days after discharge, 90 days after discharge, 6 months, or 1 year after discharge.
Most of the patients in the study were older and at higher risk for readmission.
Want me to do that for a little while?
Jean is feeling better and is now living with her sister and their dog Rusty.
Get the baby, give me the baby.
She says her experience with the virtual ward was a good one.
It makes you feel like somebody cares, really cares for you.
Catherine Dolf, the JAMA Report.